President Biden is trying to clarify his comments expressing concern about monkeypox. He says he does not see the need to institute strict quarantine measures and that the virus does not compare with COVID-19.
We've had this monkeypox in the larger numbers in the past, number one. Number two, we have vaccines to take care of it. Number three, there is thus far, there doesn't seem to be a need for any kind of extra effort beyond what's going on.
So let's bring an expert, Dr. Amish Adalja, a senior scholar at the Johns Hopkins Center for Health Security. Doctor, thanks for being here. Where do you see the threat from monkeypox, looking at the cases we're seeing around the country and around the world?
Monkeypox is not a threat to the general public. This is something we've dealt with before. What's interesting about this outbreak that's occurring now is it's transmitting person to person with people who haven't been to any of the endemic areas in Africa, haven't had contact with animals. So we've got some epidemiological work to do to halt this outbreak. It's not something that has pandemic potential or should be thought of anything like COVID-19. But it is something that we need to take corrective action. We need to use the vaccine and figure out how people are getting infected and stop those links in transmission.
Yeah, the WHO, this is according to the Associated Press, says a leading advisor to the World Health Organization described the unprecedented outbreak of monkeypox in developed countries as a random event that might be explained by sexual behavior at two recent raves in Europe. Because of what we've seen in COVID, whenever there is the next thing, people get fearful. But they should not be fearful of this next thing. Is that what you're saying?
Right. This is something that seems to have gotten into sexual networks and has been able to spread in a way that it hasn't in the past. And this is something, as we've heard about before, we had a major outbreak in 2003 related to animals. We have tools like the smallpox vaccine, which can be deployed on the contacts of cases. So this isn't something that I see spreading wide and far. We're going to see more cases. More states are going to have cases. That's expected. But it is something that can be contained and that we know how to deal with.
And children should be careful, right? If you have it, if you get it, what should people do? Obviously, go to the doctor, go to the hospital. What?
You should seek medical help. You should then isolate yourself and notify your contacts that you might have monkeypox. We know that people are contagious for sometimes several weeks with monkeypox because of all the skin lesions. You have to wait till they heal. So you don't want to be around people when you have those lesions. That's why it's kind of the bread and butter public health that needs to be put into place. Contact tracing and then vaccination of contacts. And there's a tendency to view every pandemic or every outbreak or every infectious disease emergency through the light of COVID-19 or through the lens of COVID-19. And that's not correct because these are different biological viruses with different characteristics and have very different response measures.
Dr. Adalja, that's what we wanted to have you on. Some straight talk. We appreciate your time.
Thank you.
Hey, Sean Hannity here. Hey, click here to subscribe to Fox News YouTube page and catch our hottest interviews and most compelling analysis. You will not get it anywhere else.